Of the controversial Supreme Court decision to overturn Roe v. Wade. The ruling effectively banned abortion in Wisconsin, leading many to travel out of state to get care. Medical program leaders are worried about how the ban could affect recruitment and retention, especially as the state deals with the physician shortage. Reporter Talil Mohildin explains how out-of-state partnerships are helping with training.
For a long time, Sammy Stropel has looked forward to going to medical school at UW.
To be able to, use this position that I'll have to advocate for other people.
More specifically, she wants to be an OBGYN. So when the news broke of the Supreme Court decision to overturn Roe v. Wade, she worried about what that would mean for her education.
It did scare me a little bit a few weeks before starting school, knowing that starting a career in becoming an OBGYN is something that I've always wanted.
She says medical students, residents, and schools alike are finding themselves in a tricky situation.
For one, a lot of the residents, the OB residents that are currently getting their education in Wisconsin are heading to areas like Rockford, places in Illinois where they're able to get that training.
But for many Wisconsin students wanting to get abortion education before they receive their medical degree, their options are more limited. It's the reason Senator Tammy Baldwin introduced the Reproductive Healthcare Training Act in mid-June to help support training in abortion care. In a press release, she said the proposal would ease the burden that out-of-state training brings and support programs bearing the weight of it.
I think it would be a huge change and a huge motivator.
Hands-on abortion training is not required to get a medical degree, but medical programs are required to offer it to people who want to become board-certified OBGYNs. To work around this, UW Health, for example, has created a partnership with the University of Chicago to provide OB residents a rotation in Illinois.
The Reproductive Health Care Act would dedicate $25 million a year for the next 5 years in grants to eligible medical programs.